Greetings and welcome to week 3. Congratulations, we're almost there at the end of the course. In week 3, we will focus on chapters 9 through 12. In chapter 9, our focus is on financial accountability and responsibility in healthcare. To begin, let's take a brief look at a few facts regarding finance and the healthcare industry. The demand for healthcare services exceeds healthcare's finances. The industry at large faces unique financial challenges. The ACA will add depth to how health organizations meet their profit margins. There is much complexity within the financing structure of healthcare organizations. A moral hazard exists when the insured use more healthcare services because they are covered. Testing, procedures, drugs, and other therapies must be ordered by the practitioner, none other. And it is ultimately the providers and payers who determine what is exactly medical necessary. Providers do not always welcome the inclusion of the payers in treatment and financial decisions. However, in many cases, a lot of insurance companies are heavily involved in the treatment based on reimbursement. Additionally, there can be conflict of interest between patient need and financial goals. The complexity of healthcare systems also add to the cost of providing care. And profitability can also cause ethic temptations, such as upcoding or coding creep. Let's now direct our attention towards nonprofit and for-profit healthcare entities and a few ethical underlying issues. Historically, healthcare was provided through nonprofit organizations. In recent times, the number of for-profit healthcare organizations have increased. For-profit organizations have an additional financial duty to make a profit for their stakeholders. Social justice is definitely an issue for both systems. For the for-profits, well-insured patients must be part of the patient mix to offset the cost to those the cost of those who are less affluent or less insured. Competition requires that the for-profits have the best facilities and technology to attract the well-insured. Market justice requires services that increase revenue over those that do not. According to Morrison and Furlong, there are 3 primary means to provide universal health care for a population. 1, the Bismarck model, which requires private insurance coverage for all by individual or employer mandate. 2, the National Health Services model, in which the government owns and provides all required medical services. Or 3, the National Health Insurance model, in which the government provides health insurance. The authors further contended that full implementation of ACA will present greater challenges for the current healthcare system in regards to how medical services are delivered, and reimbursements for healthcare and the ability to balance practice and profitability. The ACA seeks to control costs, access, and quality. Consequently, financing of healthcare will be a constant part of health administrators' lives. Hospital value-based purchasing program changes how business is done. This method of reimbursement is on the rise and is expected to expand beyond hospitals. Physician practices have the option to see Medicare patients, but because of this new reimbursement model, you have some private physician practices who have decided not to even accept Medicare patients. Medicare will base payment for services based on the value of clinical processes, the patient experience, and clinical outcomes. Despite its provisions, ACA may or may not slow down the growth of healthcare costs. The verdict is definitely still out on that. Let's now look at stewardship. As with any business, one of the primary goals is to make a profit. However, in healthcare administrators must be cognizant to make sure the patients feel that they are the primary goal. In doing so, the organization must balance its profit requirement with the patient care mission. This may be accomplished by stewardship. Stewardship of resources for profit and patient care starts with the O team, in which O stands for ownership. So all of the employees, meaning your primary leaders and executives, you all must take ownership of all of your resources and how you will allocate those resources to run your facility effectively and efficiently. So as a healthcare administrator, you must take ownership and assure that your employees possess the same mentality over their areas of responsibility to produce the best outcomes. Administrators need to protect their resources as if they were their own. So in other words, their ownership also means they are held accountable, and they are accountable for every single thing that happens in that facility. Let's look at some examples of how such ownership or stewardship play a role in healthcare organizations, and what healthcare administrators, or you as future healthcare administrators, can do to ensure that you have in practice good stewardship over your resources and over your organization at large. First, you must pay attention to the payer mix. Look at your patients and make sure that you have a diverse portfolio, if you will, of the types of patients that you treat, to give you a balance and hopefully offset any negative debt or any bad debt due to a patient who is unable to pay. Providing services in an efficient manner, reducing waste whenever possible, and not being afraid to make difficult decisions when necessary. And also, it's always good to think out of the box. Knowing that there is more than one way to practice stewardship is always to your advantage. Some ethical issues to consider are your decisions that affect patient justice. Market justice will make demands for profitability, and bear in mind the staff justice. So we you as a healthcare administrator have a duty to make sure that all employees and patients are treated with the utmost respect, and that all of employees, including yourself, make good, sound, ethical decisions for the well-being of your patients and for the facility at large, as well as your employees. Ethical issues from a finance perspective can occur in various forms of conflict of interest. These next few slides will give you an example of the type of conflict of interest. Some may include financial interest and professional interest, personal interest and financial interest, and the public interest. So I'm scrolling through these remaining slides kind of slowly so that you may view and make note. But feel free to stop the lecture or either go back and review at your leisure to make note of the different ethical issues. All of these topics and issues leads us now to Chapter 10. Chapter 10 is entitled Organizational Culture and Ethics. So why does culture matter? For healthcare organizations, the primary individuals who establishes the culture are leadership, the employees, and patients. In Chapter 10, you will learn of patient and cultural ethics, professional culture and ethics, and how these two integrate and add significantly to the organizational culture and ethics. We will also take a brief look at ethics committee and the administrator's role in ethics. This slide just provides a little bit of introduction and definition of culture. Culture is a broad term and is defined based on the organization. For healthcare organizations, the patient culture is critical. We treat all different types and kinds of patients. Each patient have different needs, expectations. So it is therefore to our best advantage to make sure that our patients develop trust and work well with their provider. Patients this day and time have greater access to information. They're more involved in their patient care. So both the providers and the administrators must be aware of the patient's background and overall history, and be able to understand how to treat that patient or how to support that patient as he or she receives treatment within their organization. All of that leads to a professional culture. Since the U.S. health profession is so diverse, there may be cultural differences between members of the same profession. Thus, professional rivalries often affect successful teamwork. That said, it is imperative for healthcare administrators to ensure effective, efficient communication and that patients are comfortable in communicating with their providers. The organization's culture includes its mission, vision, values, and common identity. The patients and professionals within the organization help shape the culture. Organizations have different models such as a mission-based, clan-based, bureaucratic-based, and learning-based cultures. In my opinion, there is an amalgamation of factors that affect culture in healthcare organizations. This could include not only their mission, vision, values, their overall philosophy, but in addition to the internal beings that's inside the organization, such as the leaders, the patients, and employees, you must also consider the stakeholders, the vendors, the agencies, everyone that's involved in the overall operation of the facility all play a role in shaping and forming that culture of that healthcare organization. The next couple of slides just kind of recap and provide an overview of other ethical issues and responses for organizations in healthcare. So be sure to read these slides in depth. I now want to turn my attention to the Ethics Committee. The purpose of the Ethics Committee is to serve in the capacity to address ethical issues within the healthcare organization. Specifically, depending on the specialty, as noted here on the slide, the Pediatric Ethics Committee provides services and guidance for infant care reviews, such as if there's an infant death, a disability, abuse, neglect, etc. All of these type issues will go before the Pediatric Ethics Committee, just as with a normal ethics committee within a hospital. These committees' function include education, advice, and patient case review. They should have an important place on any organizational chart within a healthcare organization, and they assist with complex issues. There are other types of ethic-based models used to assist the ethics committee in making decisions for the organization. Additionally, some healthcare organizations may hire an ethicist who are highly trained specialists within the industry of ethics. They are usually hired as consultants to the ethics committee, and they normally possess doctorate degrees in ethics, bioethics, etc. And they assist with decision making through facilitation and expertise. As a healthcare administrator, you possess the influence of the culture and the overall ethic culture within your organization. You create also a culture of caring on all levels of the organization. Your employees need to know that you care and concerned about them, as well as your patients, your stakeholders. Everyone needs to know that you are an accountable, ethical, trustworthy being who is committed to your role and committed to them as individuals. There's a lot of heavy burdens on your shoulders as an administrator, and it takes special people to do it, but definitely, as with anything, you must have the passion and want to do right for yourself as well as for all the people that's involved. As an administrator too, you need to also make sure you keep abreast on various issues that's going on, and do all you can, work with your litigation team to prevent malpractice, and just always be that role model and be that voice for ethics and ethical practices within your facility. To conclude this lecture, you might ask yourself, why are the daily actions of healthcare administrators important to the organizational ethics? My response to that is that people are constantly watching you and how you act, how you carry yourself, how you make decisions for the welfare of the whole organization. So you as an administrator, you definitely set the tone and set the standard of how things occur and basically how your facility will run. This concludes lecture 1 of 2 for week 3. Should you have any questions, please remember to email your professor. The references come from your textbook and a supporting textbook, which was another book that I used by Morrison. And as always, don't forget to complete your self-assessment to test your memory on chapters 9 and 10. It's been a pleasure. Blessings to all.